Hi, this is Dr. Birch and Lexi for the third exercise that we want to demonstrate. This one is for your hip flexor tightness. The hip flexor attaches from your spine at one end and onto your hip on the other. When it's tight, it could wreak havoc in either direction, either on the back or on your hip. And so it's a very, very common tight muscle because so much of the time we're sitting, and it allows that muscle to get tight. So it's a very important stretch. There's many ways you can do it on your own, but the best way to do it is to do it with a partner. I'm going to demonstrate that on Lexi for you. Lexi, come up on the corner. And I'm going to have when you're going to do the stretch, make sure their buttock is on the very, very edge of the bench. And then lay back. You might want to assist them with that. If their back is hurting, just let their knees come up with them and just kind of guide it. I will put her foot on my hip, and that allows me to have free hands to put some downward pressure on her leg. Again, the buttock needs to be on the end. If she's too far down the bench, you'll just drive her leg into the table. But we're putting up downward pressure to stretch that muscle that's going from her hip to her spine. Typically, we just add until the patient says that's a moderate stretch, and then we hold that for a few seconds, then invite them to lift their right arm, in this case, up and over her head and stretch and bring even a little more stretch into that muscle, the 𝐏𝐫𝐸 hip flexor stretch. After you've held it for 20 or 30 seconds, again, especially if their back is a little sore, I would encourage you to help them bend that knee up, offer your hand, and the person coming up should use their arm to pull themselves up, not their abdominal muscles. Pull with your arm and come up, and you've completed the exercise.